morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care, affiliated with three major hospitals: St. Joe, Auckland, William Beaumont, and St. Joe and Henry Ford. The theme of our health talk today is about upcoming holiday depressions among our students, the teenagers and adults, and how to cope with them. Joining us today as my guest speaker is Dr. Niru Saxena, and she has been a pediatrician for over 40 years. She has a lot of experience in pediatrics, and she will tell us about what she sees regarding the viral illnesses what in the emergency room or urgent care. Joining us today is our Ursula Bakhtyar, and she is an infectious disease and a pediatrician, and she will highlight about what are the upcoming measures, protection that as the parents can take to cope with any anxiety, depression among our children. So first question from Niru. I'm very happy to see both of you to my webinar, and I want to ask you, will you kindly, before we start, give your introduction to our viewers?
Thank you, Dr. Prasad. My name is Niru Saxena, and I am a pediatrician for like about 40 years or so, working with little children. It's a lot of fun, but it gives me a lot of satisfaction helping little children with sickness.
So that's good. You must have a lot of experience with the kids, just like we all have.
Yeah.
Now, good morning, Ursula. Will you kindly give your introduction to our viewers?
For sure. Thank you, Dr. Prasad. My name is Dr. Ursula Bakhtyar. I'm a general pediatrician, but also specializes in pediatric infectious disease, and I work for Corwell Health. I'm the chief of pediatrics there at the Corwell Health Dearborn Hospital.
So that's good. Both of us have the same specialty, right? Emergency medicine and pediatrics.
I do infectious
disease.
Yes.
But when you work at emergency room, you must be seeing a lot of other cases too, right?
Yes, we do.
Okay. So the question from how much from Niru, tell us all the viruses, what cases do you see in the emergency room? I mean, when you work in your pediatrics office?
Most of the patients these days, like in fall and winter time, comes.
Yeah, go ahead. Yeah.
They are mostly viral illnesses.
Okay.
In fall, we are seeing a lot of common colds and hand, foot, mouth disease. RSV season has also started, and then influenza we see. We already started seeing influenza because normally it is November to May. But sometimes we see earlier than that too.
Yeah, but I was checking the statistic. There hasn't been any decline when you follow the graph. It is still kind of more or less same, but we'll talk about the vaccines later. Now, from you, Ursula, you tell me about input. Tell us about the input, Why are we so much concerned about the mental health today, these days? And holidays are for happy time together, right? But I see most of the children, even if it's my practice, they're kind of uptight, they're kind of, anxious, anxiety. So tell me your input.
Yeah, I have to say this is a very important topic in this day and age. We are seeing a lot of mental health problems in teenagers, and probably because there is a lot of academic pressure, and then they have social media where they're comparing themselves with other children a lot.
Exactly.
So they cannot see what's real versus what's just portrayed on the social media. Also, the pandemic affected their confidence and social skills, and they feel a little bit more like withdrawn with their friendships and their identity. So they are facing a lot of mental health challenges because of these.
Yeah, so basically what we see. So now the question is, what are from Nutan, in the pediatrics office, you see all these challenges, the patient. So what is your input about how do you recognize somebody has a hand, foot, mouth and other viruses? So can you give your experience about briefly tell us RSV virus and the hand, foot, mouth?
Yes, RSV virus is most common and like very infectious in little babies and children. And hand, foot, mouth, normally the children have very high fevers. They cannot swallow. They have like sore throat. Then you can see the rashes on their hands and their feet.
Yeah.
And for RSV, it's normally you see cough, cold, wheezing. They can have fever, but little babies can be more sick than just common cold symptoms.
Exactly. So when you see those patients, basically what I do also, I follow the CDC protocol, I follow the American Academy of Pediatrics. So in young children, like below a year of age, then we have to be very careful about their breathing aspect, right? And there's a whole set of things they have mentioned about how do you recognize the symptoms, what is RSV and what is influenza.
RSV is normally more common in little children below 1 or 2 years of age. Influenza is school-age children.
Everybody
they are
can
very
get
sick.
it,
Anybody
right.
can get sick with
It's
very high
true.
fevers. They have like lot of muscle aches, body aches, chills, and then dry cough. They can be more sick than that.
Right.
Because influenza with high fever, you can have like febrile seizures.
Yeah,
You
right.
can have
So you
pneumonia
worry
because
more,
of that.
yes.
So
Yeah.
it's a very serious disease.
And most of these kids, like especially below a year of age, most of them need to be hospitalized.
Yes.
You agree with me?
Yes, with shortness of breath or anything, the babies get really fast, very severe. So you have to put them in hospital for their breathing.
Right, till their breathing gets better.
Yeah.
Now, Ursula, you tell me from infectious disease point of view, what do you have to add to this?
Yeah, so I'd say that shortness of breath or difficulty breathing is one of the most common presentations in RSV. While in influenza, you have very high fevers and body aches, like she said.
Right.
And then the age difference. Little babies, which are mostly newborns, are mostly at risk for RSV. This season. Influenza can also happen in those younger babies. It can be very challenging for these little ones to cope with, so they get hospitalized and get very sick.
So most of them, you refer them for hospitalization because of their
Depending on their oxygen.
oxygen
Yeah,
level.
their oxygen saturation is by far the biggest factor for which we hospitalize
Yes,
them.
right, yeah, okay. So then like, now you tell me, Nutan, from your experience, what would you advise the parents or the caretakers of their children? What are the signs they should be looking for before you refer them to infectious disease?
Like she said, most of the time, if they
The
are having
parents.
very like difficulty in breathing, shortness of breath, very high fever, they are not able to eat or drink because of their cough and everything, then it is better to send them to the hospital or refer to infectious disease people.
Right, yeah. And then, Ursula, for you, they go to infectious disease. And besides what they have, this is another chapter. There are some adolescent students, with the holiday season coming. They are kind of depressed, they are anxious. So could you comment on how do you recognize the symptoms of early depressions and how to cope with. So can you give your expertise, because you are an expertise working at the emergency room, seeing infectious disease.
Yeah, and also I do a lot of general pediatrics. So,
Right,
so
yeah.
I will tell you that this time of the year is especially very stressful for teens because
Right.
because there is a lot of changes in routines. You know, their parents have a lot of commitments during holiday season. There's
Right,
disruptive
yeah.
routines, and then also sometimes families can be facing financial hardships or grievances, and then these teenagers feel that they're not measuring up to it. So usually teenagers will become very withdrawn. They would become withdrawn. So teenagers don't present similarly to adults with depression and anxiety. They become very irritable. They become withdrawn. They don't enjoy things that they usually enjoy. They become more quiet. They're more confined to their rooms. They're sleeping more or not sleeping at all. They're eating more or not eating at all. So these are the signs that parents need to recognize that my child is not acting right, and I need to make sure that everything is okay with them.
Yeah, right. So basically, you will probably have somebody from the social service, and you will have
So once I recognize, I first what I would do is tell the parents that make sure that you are communicating with your teen.
Right.
Making sure that you have an open-ended question like what's bothering you, and then just listen. And don't try to solve the problem, just listen to them. Listening is a big thing.
Yeah.
And then once you realize that your child is having thoughts of self-harm or they're very depressed, then go and talk to your pediatrician right away. Take it very seriously.
Right.
And then make sure that you ask your pediatrician to refer you to a mental health provider, like a psychologist or a psychiatrist, to help your teen. I also want to mention here that there is a crisis line. I think the number is 988. And it's for teenagers and adults. And if you feel that your teenager is going through a depression where she could be danger to herself or to others, please make sure that they call the crisis line. And because it's after hours, you can't find your pediatrician, call the crisis line so that they can talk to your teen and calm them down.
Yeah. So even, with my clinical practice, almost 50 years with all these pediatrics, emergency medicine, I have noticed the fact that is very important, first of all, look at the child, a visual, and then look at the parents who are bringing them. I have so many interesting stories working in the pediatrics emergency medicine. So, but I have done a lot of Google search and researches, and very good articles have come out from the Mayo Clinic, and they have another one for the suicide prevention. But the one I find very interesting is the SAMHSA. You are aware of that, because that is substance abuse and mental depression. So anyway, for our viewers who are watching me today, please watch for early symptoms of your depressions and depressions in your adolescent student. Why they don't want to go to school? Why do they have school phobia? Find out the cause.
Keeping an eye on your teenagers, staying connected with them, supporting them, also telling them that we are always there for you is so important. And then also keeping an eye, making sure they're hanging out with the right people. A lot of times teens want to hang out with people who are depressed. Depressed teens hang out with depressed teens.
I know.
And you're thinking that they're hanging out with friends, they're happy. But they're actually sulking together. So you want to keep an eye on their friends. You want to keep an eye on their
social media,
social media monitoring.
Yeah, very
sure.
important for them. Social media.
There's so much fakeness on social media. So teaching your teens that distinguish this is not real. Reality is what we are living, and be grateful for what you have. Teaching them gratitude is important.
Right. Social media and social platform, very important. Last month I had some interviews with some high school principal and their psychiatrist, their counselor, and the basic is they have, most of them have stopped using cell phone at the classes. Do you agree with that?
I agree with that. I think that you cannot take away the importance of the phone with the teenager, because in the light of all the circumstances that we are facing in school shootings and stuff, teenagers should have their phone, but they should absolutely not be allowed to use their phones during class. I think in a lot of schools they have a basket or something where you leave your phone and then do the class. I don't think that they should be allowed. Excessive screen time leads to a lot of depression.
a lot of depression.
Lack of
Nutan,
focus.
Do you have anything to add to this?
No, she's saying correct. That's what I am seeing in my offices too.
Right, yeah. So, I summarized most of them, and I have written a lot of articles about depression, suicide among the youngster. The very good example I find it is from what the studies have come out from John Hopkins studies, American Academy of Pediatrics. They have a lot of information how to recognize the symptoms and what do you do. So now, question for you, Arcila, would you comment about the use of nicotine, alcohol, and drugs?
Yeah,
Among
so
them,
any
you
kind
must
of
be seeing them.
I do see them, but when they get to the point where they're using drugs and alcohol,
Right.
then we have to refer them to a psychiatrist who is actually expert in dealing with mental health disorders along with substance use.
Yeah.
But there's a strong correlation, just to make the children who are going through depression, they don't want to feel those feelings because it makes them more depressed. So by
Exactly,
using
yeah.
drugs and by using alcohol, they sort of temporarily
hide it,
suppress
yeah.
those feelings.
Yeah.
That's why I say make sure you're having good company. And pediatrician's job is at every visit when you're talking to the teen patient,
Yeah.
talk to them about the disadvantages of vaping, substance use, not just nicotine, but marijuana. It's so common amongst
Marijuana.
teenagers
Yeah, I
now.
was going to ask you. That
it's-
was my another question, about the marijuana, because now they have it's legalized. So
and it's
everybody-
easily available. It's legalized, but not for underage people. So
Yeah,
you
yeah.
still want to make sure that you're keeping an eye and telling your teenagers not to use it.
Yeah.
And keep a check. You will find something. Keep a check on your teen. Though you give them the independence,
Yeah.
which they deserve, you
Yeah.
still, as a parent, have to keep an eye on them.
Yeah. And I advised, for Nutan, don't you agree with me? The parents should check their school bags, what they are bringing from school and all that.
In this day and age, people won't agree with that,
yeah.
but I think it's not a bad idea.
It's not
if
a
you're
bad-
noticing symptoms.
If you notice anything.
Then you can see if they're into any kind, because it's so strongly related. Substance use and depression is strongly related.
Yeah, and the reason I am emphasizing on this fact for both of you, one holiday around this time, we went to Mexico, for vacation. Here the bus comes and loads about 30 kids, and they are students from some school, they are laughing, they are giggling. They're very happy. So it came to my mind, why are they so happy? So next day, we go to sit on the beach, and I see all those kids sitting in a circle, and everybody has one candies, different kind of candies, and they are exchanging those, and apparently those are mixed
Yeah.
medications,
And here that happens, peer pressure is so huge amongst teenagers, One teenager is smoking, and when someone is doing a wrong thing, and I would like the teens, if they're listening, that if somebody is doing wrong, they would love to have somebody else do wrong with them.
Right, exactly.
So they would attract you to do it, and then they would
Yeah.
make fun of you or mock you if you're declining the offer of doing it. Just teenagers have to be very confident in saying no to things they don't feel that they're right.
Exactly, yeah.
And then don't get into that ditch of like peer pressure.
Yeah, I followed them. I have not an authority to report anybody, but quickly I walked and they said, all those candies, they were not real candies. They were a mixture of all the...
Yeah, there are gummies that contain marijuana.
Yeah, gummies
and,
and all those. And that's what I was thinking, because now holiday season is coming and we will see...
You have no idea on Halloween how many kids
Hello, yeah, I was going
get
to
those
ask you.
candies that are marijuana gummies. I've had patients come to ER with somnolence, and then we found out that they were given candies that contained...
Candies,
Yeah.
the mixed drug,
Yeah.
the fentanyl.
Maybe erroneously, or I don't know.
Yeah, all these things are becoming so
Very
common.
common. Yeah.
And everybody, they are trying so hard. Our government, they have all those legislation passed, banning alcohol and banning all those things, And then, would you comment about Arcila, would you comment about the biologic with the environment, like why they are doing those things? Because of the low serotonin level in the brain?
Yeah, so there are different causes. I have to say that circumstances plus the pathophysiology of depression.
Yeah.
As a combination of that, you have depression. So people say, or it's a taboo, mental health is a taboo. When a child is going through some sort of depression, people think it's the circumstances or change your friends or you're too much on social media. But it's a true illness that does happen because of the disturbance of serotonin in your brain. So you want to recognize that this is a true illness and it needs and requires the same amount of treatment for any physical illness. So if you have high blood pressure or you have a heart disease, you take medication. Same as with depression and anxiety. In children, I try to avoid medication as much as I can because behavioral therapy is another approved way to help with depression and anxiety. But medication is another option if it is in severe circumstances or if they're refractory to therapy. But it is not just circumstances. Some people say just be religious or talk to God and your depression will go away. I mean those are all important things. Spirituality, exercising, keeping yourself busy is one way of combat it, but it's not the treatment.
Yeah.
Treatment is behavioral therapy and medication.
Behavioral therapy has become so important.
Yeah. So important.
Yes. Nutan, you agree with us?
Yes.
It has become so common, the behavioral therapy. People need to know. There are kids, who have some underlying issues. But those underlying issues, like history of diabetes, high blood pressure, autism or something. But the most important thing is they have to realize what are the factors.
It's a true illness.
Yeah, very good articles have been written in Mayo Clinic, Suicide Prevention, SAMHSA, and the Academy of Pediatrics.
Yes.
Now, Nutan, what will be 1 minute keynote advice you will give to your patients and the caretakers?
The main thing is try to be first thing is your good hand washing. Don't send your sick kids to daycare or school because that's where it spreads. During this season, when winter is there, basically what happens is the kids are coughing, sneezing on each other, and that's how you spread it. So use if you want, you can use mask or proper distancing. And then cover your cough, wash your hands frequently.
Vaccines.
And then there is the big thing is vaccine, because for RSV we do have a vaccine below 8 months of age when it is very common, it is very dangerous because it can lead to shortness of breath and in the hospitalization and everything. And for influenza they have a vaccine.
Have flu vaccine.
Yeah. And that does help lot of severity goes down if you have the vaccine. And the second thing is the rate of spread and everything is also going down with the
Now last
vaccine.
minute keynote advice to our viewers, Ursula, with your background of all this.
So I would agree with Dr. Saxena about illnesses, but for mental health, I'd say that be connected with your children in this busy day and age when parents are busy, full-time working, and they're also relaxing on their phones while their teenagers are relaxing on their phones. Give time off of your phone during dinner tables, talk to your teenagers, and seek help. Although sometimes it's embarrassing in certain cultures that my child is going through a mental health disorder, make sure that your pediatrician is your biggest support and is aware. Make sure that your pediatrician is aware and they are there to help you. Bring it up and don't hide it. Don't hide your feelings.
And have a kind of visual diagnosis.
Yeah, and parents and children should
important
talk
as they walk into the room. Yeah. So now I like to thank our guest speakers, Dr. Nutan Saxena, with a pediatrician for almost 40 years, Dr. Ursula with all her
Thank you.
Her biography and her CV is so extensive, hard even for me to remember. I like to thank both of you to coming to my show, and the topic was holiday challenges among our students and how to face them, how to meet with them. And I like to thank our viewers for watching me on my health talk. And I like to thank our producer for helping me prepare this wonderful tape. And until I see you all again, have a safe and a wonderful holidays.
Thank you so
Thank
much.
you. Thank you so much.